Hello there, Dr. Brian McKay, and speaking for the Back Pain Project today. And the topic I want to touch upon is PEMF therapy for back pain relief. All right, first of all, what is PEMF therapy and how does it work? PEMF is an acronym for Pulsed Electromagnetic Field Therapy, and it consists of a device which emits pulses of energy waves. You might feel it, but it's very, very subtle. What happens is the energy courses through the body directly to damaged or injured areas, and it's drawn to areas specifically or where you're feeling chronic pain and inflammation. And the energy the PMF device passes through the cells in your body, amplifying, like really ramping up the cellular energy. And the increase in energy promotes a natural reaction that regenerates and enhances the efficiency of the cell's function. This is the natural process, stimulates healing, and will improve your overall well-being. We've been using it for several years here at the Back Pain Project. It's a great adjunct to the overall therapies. Now, we do many different therapies, but today I just really want to focus um, on the PEMF or the pulsed electromagnetic field therapy as it relates to back pain. There are a lot of different devices out there. And if you can buy one from home, I think you just got to do your homework. I don't really recommend any one over the other. I mean, some of them are very expensive. There's multi-level people out there promoting PEMF, and PEMF I think is wonderful. Here's what you need to know: there's no side effects. Basically, it's very, very safe. And maybe if you have a pacemaker or an implant, that's not really going to be helpful. But I wouldn't use it. We've screened our patients for that anyhow. So that virtually few side effects. But it has been shown to be beneficial for health. There are many clinical trials that prove its efficacy, and all different fields are using it. Veterinarians are using it. Obviously chiropractors, physical therapists, and massage therapists. And a lot of people using it for post-surgical pain edema. After cosmetic surgery, and they notice there's a lot less side effects from the surgery. So when we use it for back pain, we just think about it. It decreases swelling and it decreases the pain. What a wonderful, wonderful combination. And the PMF, also the therapy benefits people with musculoskeletal pain like fibromyalgia or chronic low back pain. So the FDA does regulate the PMF therapy, specifically for post-spinal surgery. It's been shown to enhance bone formation, non-union fractures, or after lumbar or cervical fusion, spinal fusion. So that's not a bad thing if you see it's getting, it's helping, post-surgical fusion cases, for the lumbar spine or the cervical spine. Do some people use it in addition to pain relieving medication? Yes, it's going to make the body more efficient. Okay, it improves the overall health of the cell. And on that tiny level, the cell, it stimulates, to me, production of ATP, which is adenosine triphosphate, which is what's produced in the mitochondria of the cell to produce energy. So more ATP production and more energy the cell has, the quicker can you bring about healing. It also helps enhance transfer across the cell membrane, so you're getting the garbage out of the cell and the good stuff into the cell, the nutrients. It's right now there's less that people know, and I think one of the best ways for you to really get a handle on PEMF, if you just go onto YouTube. I know this is like passing the buck. Check out Dr. Oz PEMF and watch it. It's a very interesting article, very interesting show, but it shows that there's something there. I mean, I always tell patients that myself. It's like, listen, Dr. Oz on YouTube. If you don't believe me, believe him. But so if you have a low back condition, it's going to relieve the pain intensity and improve the functionality. Of course, further research is needed, but in the meantime, if you're suffering from back pain, this is just one of the protocols. I mean, again, I'm stressing, it's one of the protocols that we use here to treat chronic low back pain at the Back Pain Project. So I can't say enough about it because I do see results with our patients. We also use it for our neuropathy patients as well. So it's one of those things, I think you just do a little bit more homework. I'm here to tell you it's safe and effective, and it's non-pharmacological. so you don't have to take another medication because, we're all aware of the opioid crisis that goes on in this country. And a lot of people turn to opioids after having back pain, chronic back pain, and they can't get the heavy duty medications any longer. So they turn to these more powerful drugs. Pretty sad, but I have had several patients. I've seen it. Um, Obviously, we don't treat opioid addiction here, but it does come into contact with us because someone with low back. I mean, you have to understand, low back pain is going to it's going to complicate so many areas of your life. So many areas. It's crazy. It's like you can't exercise. And you know what? When I can't exercise, I get cranky. We're going through this COVID right now, and I can exercise, but not the same way I could beforehand. And who knows when we go back to it? So it's you're not exercising. I'll tell you another thing that most chronic back pain sufferers have: they're not sleeping good. You can't get really into a comfortable position, so the body just resists going into that deep state of restive sleep. So all these things add up. So when you're searching for help with your back pain, PEMF is something you could do at home. I mean, if you had the funds to invest in a home unit, I think just the fact that you're going to get better sleep, it's going to take out some of the pain and inflammation. It's not a harmful thing. I mean, I do know that some of these things go for several $1,000s. So it kind of limits it. I mean, we do our PEMF here in the office, we can absorb the cost and we can have more patients use it. But it is something to consider. And again, my advice is Dr. Oz YouTube PEMF therapy and watch it. And you'd be surprised. I kind of do believe, I don't think he's a huckster at all. I think he's pretty factual with his information. So I urge you to go ahead and give it a try. Give it a try. If you guys have information, listen, the internet is full of it, of information. I'm saying full of BS, but full of a lot of good information. See how it applies to PEMF and see how it applies to you, because it might be that difference. I mean, first of all, if you get a good night's rest, your body can heal. And if it can't, your body doesn't heal. I myself have used the PEMF post-surgery. It's hard to say whether it helped or not, but I do feel a lot better. And, I'm looking at the studies myself. I don't just come in about this and talk off the top of my head. I do my research. But we've been using it now at the Back Pain Project for several years. And I think it's something to consider. But that's only one part of the many different special services we offer here at the Back Pain Project. Dr. Brian McKay, looking to fix chronic back problems? Give us a shout, 203-656-3638. Thanks very much. Have a great day.